Alright team, we have a patient presenting with pneumonitis, paramyositis, and enterocolitis. Let's brainstorm and diagnose this case.
It could be a rare autoimmune disease like dermatomyositis.
I'm leaning towards a possible fungal infection causing these symptoms.
What about an allergic reaction leading to this condition?
I think it might be a case of mixed connective tissue disease.
No, no, and no. I said brainstorm, not spout a bunch of stupid ideas. It's tracheobronchomalacia. The patient needs transoral robotic surgery immediately.
But that's a risky procedure, Hawks. Are you sure that's the right call?
I'm the doctor here, Gary. We don't have time to waste on debates. The patient's life is at stake.
Oh no, another transoral robotic surgery.
Yes, we have no time to waste.
Hawks, you probably want to rethink who you let in charge of it this time.
Oh, you're right. Okay, Frank, you're gonna play with a cool toy today. Don't break it or Tracy's gonna have us all publicly executed. Tracy, I need to talk to you about my patient. I truly believe performing transoral robotic surgery is the best option for him. He has tracheobronchomalacia, and it's the most effective treatment.
Hawks, I understand your expertise, but we need to consider all options here. You have a history of making bold decisions that didn't turn out as expected.
Hey, that's happened a couple times, but I have strong faith in my doctors on this one.
Were you sure to lecture them on the safeties of operating a robot for surgery this time?
Yep, and I threatened all of them with my cane to know I was serious this time.
I doubt half of them consider that a punishment.
You're the one turning this into a sex joke, Tracy. Don't be disgusting.
Gary, have you seen the latest results on Mr. Simpson? It seems he's in critical condition after the transoral robotic surgery. The good news is Frank didn't break the robot, unlike a certain someone in here, but the patient isn't getting better.
Yes, I did see the results. It's concerning, but I'm not entirely surprised. Transoral robotic surgery was not the right treatment for tracheobronchomalacia, despite Dr. Hawk's insistence.
You're right. We need to figure out the best course of action now. What do you think the right treatment should be for Mr. Simpson?
Well, we could start by stabilizing his condition and then considering a more traditional surgical approach to address the tracheobronchomalacia. It's not ideal, but it's the best option we have at this point.
I agree. We can't afford to make any more mistakes. Let's get to work on a new treatment plan for Mr. Simpson.
You imbeciles nearly killed our patient with your ignorance. Tracheobronchomalacia? Are you kidding me? That's not even close to the right diagnosis.
But I did good with the robot today, Hawks.
That's great, Frank. But the robot didn't quite fix Mr. Simpson now, did it?
Mr. Simpson? Who did we operate on? Homer, Jay?
John Simpson. Besides, one of those is fictional and the other is deceased.
So, Dr. Hawks, what do you think the correct diagnosis is then?
I shouldn't have to do your job for you. It's obviously a case of idiopathic subglottic stenosis.
We're truly sorry, Dr. Hawks. How would you recommend we proceed from here?
Proceed. You lot are lucky I don't report you all to the medical board right now. Just stay out of my way and let me fix your mess.
At what point does your lunch involve fixing our mess?
I like to order 4 boiled eggs. Name them all after you, then smash them open with my cane while I think of happier days without all of you.
We'll make it right, Dr. Hawks. Please, tell us what we can do to help.
Help? You want to help? How about you start by never making a diagnosis again in your pathetic careers, you bunch of quacks. I'll handle this myself. Don't you dare step foot in that operating room again.
We understand, Dr. Hawks. We'll stay out of your way. Please keep us informed of the patient's progress.
Informed. I'll do more than that. I'll save the patient's life that you almost ended. Just stay out of my sight before I really lose it.
You've already lost it, haven't you?
No, they did. I order the same thing every day. 4 boiled eggs. How damn hard is it to keep a supply of them in this cafeteria's vending machines?
They only get restocked twice a week.
Do they realize what kinds of risks they're taking? Assuming we will all happily starve ourselves if it means we can think quickly of the right treatments for our patients when they're coding?
They assume most of us can actually pack a lunch like I do.
That's a lie. You've never made an egg salad sandwich better than the vending machines.
Ouch. I guess some of us have little patience to do that on a regular basis.
You know, speaking of patience, I've been working on this perplexing case lately.
Oh, what's been going on with your patient?
I think I finally figured it out. It's a rare condition, but all the symptoms point to it.
Wow, that's amazing. What is it?
I'll have to go check on my patient right away. Thanks for the chat, Johnson.
Wait, you're leaving already. We didn't even finish lunch.
Here, I haven't finished nibbling on the egg I named Gary.
The one you threw to the floor as soon as it exited the machine?
I have a new diagnosis for this patient.
Hawks, where's your protective gear? You can't just storm in here like that.
Yeah, we have protocols for a reason.
Hawks, this is serious. You need to follow the rules like the rest of us.
Tracheobronchomalacia was misdiagnosed. It's warfarin resistance.
Warfare and resistance. What's the prognosis for that?
It's not good. High risk of thrombotic events. We need to act fast.
How'd you come up with this? Who did you consult with?
I discussed it with Dr. Johnson over lunch. Trust me, this is the right call.
Dr. Johnson works in oncology. How would he declare something on your patient?
He knows how to use the internet. For good. Unlike some of you degenerates.
What are you even referring to?
I wasn't going to publicly say it, but I know one of you has been logging into my computer recently and looking up Rule 34.
Maybe they were looking for the hospital rules.
Don't get smart with me. We all know it was you. Who else would sneak onto someone's laptop to specifically search for Super Mario Rule 34 art? I can't believe I made such a critical mistake with the diagnosis.
It's okay, Hawks. You eventually got it right.
But this wouldn't have happened if the other doctors weren't so incompetent.
Wait, are you shifting the blame to your team now?
Well, they should have caught my error before it escalated.
Hawks, you were the one who made the wrong diagnosis in the first place.
They're all eggheads. Every single one of them.
What does that even mean?
Oh wait, I said that out loud. Sorry.